Assalamualaikum to all students. I'm Dr. Nurwati from the Family Medicine Unit. So today I'm going to give a lecture on approach to patients presenting with chronic diseases in primary care. So what are the learning outcomes for this lecture? So at the end of this lecture, I hope you will be able to discuss an example of consultation method used in primary care, outline the approach to patients presenting with chronic diseases in primary care, and plan a multidisciplinary approach according to patient's need. So in previous lecture, I've actually taught you on how to approach patients with acute presentations in a primary care setting, in which we usually don't go taking a full history and full examination for patients coming with an acute symptoms. So for this lecture, I'm going to teach you the approach on how we consult patients with chronic diseases in primary care. So as you know, the burden of chronic diseases are increasing, and currently it is managed at primary care level. For example, in primary care now, we are managing cases like diabetes, hypertension, asthma, COPD, and other cardiovascular diseases. What are the problems in managing chronic diseases in primary care? One, it is because when a patient comes to a primary care setting, they usually have multiple diseases. This is in contrast to when they go to a specialized clinic, they will be managed as a single disease. For example, if they go to respiratory clinic, they just present as an asthma patient, although at the same time they may also have diabetes, hypertension, and heart problems. Similarly, when they go to a diabetic clinic in a hospital setting, physician clinic, they will be managed as a diabetic patients. Despite that, they have many other multiple problems. The second problem when we see patient in a primary care setting is limited time. You may have about half an hour to see a patient in a physician clinic, but in a primary care setting, you probably have about 10 to 15 minutes to actually manage a patient. The third problem is limited resources. That is common. In health clinic, we don't have many resources such as laboratory. We do, but the facilities is limited. X-ray. We don't have any X-ray unit in most primary care setting. So the investigation that we can do in a health clinic is quite limited. So how to solve this problem? One, a patient having multiple diseases. Number two, we have limited time to actually manage this patient. So the most important thing on how to approach patients with chronic problems presenting to primary care is one, to prioritize. Number two, using evidence-based and multidisciplinary approach in managing these patients. Okay, there are actually many consultation methods that you can use in managing patients in a primary care setting. The first one is called Stott and Davis method. You don't have to remember all this. And then the second one is the ABCD method. This is what we call ABCD methods. Okay, because A stands for management of acute problem, B, behavior modification, C is management of chronic disease, and D is the disease prevention. Remember, when a patient comes to a primary care clinic, it's not necessarily they come only with the chronic problems. They also have an acute symptom or acute problem on top of a background of multiple chronic diseases. So that is why we use the ABCD. How you actually plan your management or consultation in a primary care setting. So, in previous lecture, I've actually taught you on how to approach patients with acute problems. So in this lecture, I will focus on how to approach a patient with chronic disease without any acute presentation. So, in the history, usually we would ask the patient to list the medical problems that they have, such as, can you tell me what medical problems do you have? So that we have some ideas of what medical problems that the patients are having. Because in a primary care setting, as I mentioned just now, they can come with multiple problems. Okay? For example, 1, this patient has diabetes. Number 2, this patient has hypertension. Number 3, this patient has cholesterol problem. Number 4, this patient has asthma. Number 5, this patient has osteoarthritis. So this will shorten our consultation time when we already know or summarize the patient's problem. Another mistakes that doctors or students do in a primary care setting is asking about the old history, such as how was the disease presented initially last time? How were you diagnosed with hypertension? So it is going to take a long time because the patient has to go back to an old history and a long story. So I'm going to inform you that history taking for chronic diseases is a bit different from what you have been practicing in a hospital-based case, where you usually would ask your patient on how the first presentation was like. Okay, after we have got all the medical problems listing, then the second step is prioritize the most problematic problem. Meaning that if the patient, like I mentioned just now, she has 5 problems, you may need to ask the patients, what is the most problematic problem during this consultation? The most problematic problem to the patient may be different from what the most problematic problem from your definition. For example, during this consultation, maybe the patient consider that her osteoarthritis pain is the most problematic one, but to your definition, the most problematic problem in this consultation may be her diabetes, because her fasting blood sugar today is 20. So there are two ways on how you prioritize patient's problem. One is to the patient's definition. Second is to the doctor's definition. Okay. And then in the history, there are 4 important history that you need to ask the patient. And all start with the letter C. One is you need to ask about the current symptoms. Second is the current control or status. Third is the complications. Fourth is the compliance. So there are 4 C's: current symptom, current control, complications, and compliance. Okay, for physical examination in primary care setting is quite selective. That means you need to confirm the diagnosis or problems based on the history. That is, what is the most relevant physical examination at this visit? Remember, in a primary care setting, we have the principle, one of the principles is continuity of care. That means you will be seeing these patients many times, so you can save some of the history and physical examination in the next visit if it is not relevant during this visit. For example, in the patient just now, that I give you an example, the patient says that the most problematic problem during this consultation is her knee pain, osteoarthritis. So what you need to do is asking the history further on the knee pain, and second, you need to examine the knee, whether this patient has an acute flare-up of osteoarthritis. Okay, number 2, from your definition, the most problematic problem during this consultation is her diabetes. So what you need to do is to ask symptoms of hyperglycemia, such as polyuria, polydipsia, lethargy, weight loss, and in physical examination, you need to examine for the symptoms of hyperglycemia. For example, this patient has HHS, so you need to examine the blood pressure, whether the patient is hypotensive, and other things that you think is relevant during this consultation.